In this video, we provide an overview of lessons 2 and 3. These two lessons work together to help students integrate history and science using first-person reporting from historical documents about pandemics in history. These documents contain quantitative and qualitative data about past pandemics and epidemics. Based on what we discover from these documents, we are able to determine which pandemic has patterns of spread and/or characteristics similar enough to COVID-19. Identifying similar pandemics from history allows us to investigate the mitigation strategies that were successful in the past, so we can make decisions about solutions that may work best now. In trying to answer the question, how can past pandemics help us learn about the COVID-19 pandemic, the lesson uses various visual representations to build understanding about big ideas and concepts related to outbreaks, epidemics, pandemics, and global pandemics. The models are not perfect and may be supported, challenged, or modified as a result of discussion. That is expected. This will allow students to revisit the driving question and develop meaningful ways to represent their own thinking, such as deciding on symbols and diagrams they want to use, which make sense to them. Students take a case study approach to the analysis of other epidemics and pandemics. Students compare public health crises using different types of information from historical records, such as timelines, maps, data, and images. Each case presents numeric and textual information that students can use to make sense of the public health problem. This activity is structured to allow for differentiation and small group learning. By the end of Lesson 2, students share thoughts about what they were better able to understand as a result of the case studies, such as the connection between history and science and people's experiences during past pandemics. Helping students to connect their experiences now to the experiences of others from the past creates a sense that people have figured out ways to respond to and move past pandemics. By narrowing in on the 1918 influenza pandemic as closely related to what we are experiencing now, the navigation at the end of Lesson 2 sets students up to take a deeper exploration of how different locations experienced the 1918 influenza pandemic and what we can learn from those experiences.
Epidemiologists depend on documentation when trying to communicate about diseases to the public. The importance of first-person accounts and primary source information cannot be underestimated. For Lesson 3, students are trying to answer the question, what can we learn from how the 1918 influenza pandemic ended? To answer this question, students work with archival information stored as an event timeline. Additional evidence from personal essays or archived photographs are provided that can deepen students' understanding of the 1918 influenza pandemic. There are two timeline activities for this lesson. The first timeline activity allows students to explore the timelines for cities based on archival records. The second timeline activity organizes events from the 1918 pandemic from the first case reports to the point at which the pandemic ends or is declared ended from a social context. Using the same period of time, about 2 years, events that related to the pandemic are listed adjacent to another timeline of historically significant events happening at the same time. World events in the early 20th century were complex, much like today. Social unrest and tough economic times characterized the period in history when the 1918 influenza pandemic impacted the entire world. The notion of equal rights for all, regardless of gender, race, class, able-bodiedness, or nationality, then, like now, was not always clear but remains a necessary component of public health and safety. This lesson will help students understand some of those big ideas. At the end of Lesson 3, students have identified many of the mitigation strategies they hear about today, such as wearing masks and social distancing, as ones that people found to be effective during the 1918 influenza pandemic. But at this time in history, people did not know that a virus was spreading the disease. How did people in 1918 figure out that these strategies worked to stop the disease from spreading person to person? This question puzzles us at the end of Lesson 3 and gets us thinking about how we could approach slowing the spread of disease even if we don't know much about it, like what's causing it.